Hello, and thank you for joining us for this panel conversation with nurses and nurse educators. We are so glad that you're viewing us. I'm Ellie Pierce, a pre-nursing advisor at the College of Health Science at Boise State University. We are blessed to have 4 highly experienced and skilled professionals from 2 prestigious Idaho institutions participating in this panel. And in just a minute, they will introduce themselves, and then we'll dive right into a conversation about what it's really like to be a nurse.
My name is Joanne Adams. I'm originally from Kuna, Idaho. I graduated from Boise State with my RN in 2003. I got my BSN online in 2018 from BYU, Idaho, and I'm currently about to graduate from Idaho State University with my Doctor of Nursing Practice, family nurse practitioner.
Thanks, Joanne. Paula?
Hi, I'm Paula Shaver. I was born and raised outside of Chicago, Illinois. I got my first associate's degree RN at a community college in Ocala, Florida. I got my BSN online through the University of Wisconsin, and I completed back in 2010 my master's as a nurse educator from the University of Wyoming.
Awesome. Thank you, Paula. Max?
Hi, everyone. My name is Max Velman, and I'm actually from Austin, Texas. I'm here at Boise State, and I went to the University of Texas at Austin. I actually have a degree in kinesiology, and I went through an alternate type of program to get my master's degree from the University of Texas at Austin a few years after I finished my bachelor's degree. I also completed my my pediatric nurse practitioner certificate, and then moved to Boise. And then while I was in Boise, I took advantage of a program where I was able to get my PhD from the University of New Mexico. I teach a lot of pediatric nursing here at Boise State, and as well as I'm doing a lot more clinical coordination for our undergraduate program. Oh,
Thank you, Max.
Thank you.
Okay, and Dr. Tony.
Hi, my name is Dr. Tony Christopherson, and my hometown is actually in Weyburn, Saskatchewan, and that's up in Canada, a very rural part of Saskatchewan. I took my diploma in nursing and my bachelor's in nursing in Saskatchewan, Canada, and that was at the Wascana Institute and the University of Saskatchewan, respectively. I took my master's of nursing, at the California State University in Sacramento. And then I did my doctorate in educational leadership, and I got that from the University of Southern California. My current role is the Accelerated Program Coordinator at Idaho State University on the Meridian campus.
Awesome. Thank you so much. Thank you, Tony. The 2 institutions work hand in hand for students who are interested in either a BSN or an ABSN. So, Joanne, would you please describe the path that led you to become a nurse? And then tell us if you had concerns or insecurities about making this choice.
Well, when I was first in college, I wasn't sure what I wanted to do. So I was starting with just general classes, but I had a roommate who was a nursing student, and she was so excited about what she was doing. And I was acquainted with a couple of others, and just hearing about it from them, it sparked my interest. I talked to some nurses that I knew, and it felt like it would be a good fit for me. So I went for it, and I got into nursing school, and it's very challenging, but I loved it. And it was a good fit for me. And then, yeah, I've never looked back. And one of the things I love about nursing is there's so many different things you can do. It's such a broad field. I have friends who are nurses that work as school nurses, as prison nurses. I've known nurses who worked for corporations. There's always new things coming up. And so it's just such a diverse field. I think more than a lot of people realize. As far as insecurities, yeah, there were things I was nervous about. There always are, but you get out there and you do it, and you find what works for you, and you just keep going.
Awesome. Thank you, Joanne. That's a wonderful answer. And it does address some of the questions that pre-nursing students have asked me. So we're going to move down to the second question, and this is a question for Dr. Paula. How would you describe the nursing shortage? How do you feel you are having an impact in this crisis? And please describe how this impacts you in your role as a nurse.
Well, the nursing shortage continues to get increase because we have an aging population, and some states have more of an aging population than Idaho does, and Idaho has nursing schools that are pumping out new nurses. As far as helping with this, I mean, I stay in my role as a faculty here at Boise State. And whenever I'm out and about, I usually try to represent Boise State, and I talk to some undergraduate students who aren't in the program, and I always encourage them to come into nursing. So hopefully that'll bolster our ranks a little bit. But during this COVID crisis, especially, we as nurses, I think, have gotten able to expand our wings a little bit more. I mean, we're trained to do a ton of stuff that sometimes we're not allowed to do in the medical model. But now I find I volunteer at a clinic, and I'm helping with telehealth visits and doing more telephone work, which is a good thing for nurses to do. I think as the model starts slowly changing with we're getting paid based on value, I think nurses are going to become a very important part of that because we do kind of coordinate everything. So I see the profession moving forward again and letting us do everything that we've learned to do.
You know, I remember a long, long time ago when you taught me about advocacy for patients. Mm-hmm. And I know that that is an issue now, especially for the aging population. And I appreciate you mentioning that, you know, we work with telehealth and we try to do it for people who perhaps would be better advised not to come down to clinics, not to expose themselves to possibly infected populations. And I really appreciate that response. Is there anything else you'd like to add about nurses' roles during the crisis?
Just like I said, I think we've been allowed to expand a little bit more. And it's something that nurses have been trying to do with everything that we're taught. And this has just given us a little bit of help in getting ourselves out there and expanding our roles. And that's been nice.
Well, as far as I can tell, y'all are national heroes. Thank you so much. Let me move down. Max, what do you feel is your most rewarding component in your role as a nurse?
Oh, thanks, Ellie. I thought a lot about this question. You know, the most rewarding thing. It's actually, I think you guys would agree. It's difficult to just say what the most rewarding thing is about being a nurse. I think that what I like to, this may sound a little trite. I have some notes here. I think I really like helping people, but I also like how nursing helps me. And let me explain that. I like to, you know, right now my role as a nurse is a lot of things I do really are helping nursing students. So I like to think that by helping nursing students, whatever I could do to help someone, I'm doing it times 400 because there's 400 students in the Boise State program. And so that's one of the things it makes me happy to think that, well, I could go out and pull someone out of a burning building, or I could, you know, do something very impactful at the bedside in a hospital or working in a clinic to do some good teaching. There's so many things that I actually do, but I also like the fact that I'm kind of spreading the wealth of knowledge. And I think I'm just lucky that I have the ability to do that. But also as far as like things that help me, you know, I think that it's nice if people, anyone who wants to be a nurse, who's actually in nursing school, you just don't forget that you can't sustain a career as a caregiver if you're not sustaining yourself. Obviously, you eat right, exercise, get plenty of sleep. Yeah, of course. But you want to be doing something that's meaningful. And that's something that for me is very impactful, where it's not just like I would hope that none of you guys who are watching this are thinking, I need to do something just for money because that's the sole point of having a job. It's like, no, I want to have something impactful. So that's, I think, what builds your mindset into having a healthy career, is if you are doing things consistently that you feel are bringing value, that line up with your value systems. And that's probably the biggest, most impactful thing for me as a nurse. Is it's very rare that I do something in a professional capacity that is meaningless, or something where I just made money. Oh, look how much money I made from that transaction I just did. I don't want to knock people who make money. That's great. But if you're doing things where you're feeling like you're consistently helping others, then that's the most impactful thing. I don't want to take up all the time here, but I had some examples. The biggest example I could tell you those is, of all the things I've done, I think it's when I did PD oncology. I did pediatric oncology. That's kids who get cancer, and not the kids, it's the family that's impacted. That's a really big deal. But when I first became a nurse, I was petrified of emotional conversations with families. I worked in the ICU, so I wasn't a stranger to kids dying, but I would try to not to let it affect me, because sometimes, letting yourself be affected by emotional situations, that can be tough. It's a learned skill, I think. But years later, I had the opportunity to start, instead of being a critical care kind of macho strut around the hospital like I'm all that kind of nurse, I evolved, many years later, into someone who actually had the ability to work with families who would struggle through the suffering and maybe eventual loss of a 4-year-old and a 7-year-old. That's very devastating. And I don't want to market it to you guys as if it's fun. I would never use the word that's fun, but it can be very rewarding to help families go through a process. Don't forget, everybody's going to die, but not everybody's, able to deal with the death of a young child. That's really challenging. But I have some fond memories of that. It may sound weird, but I have fond memories of a lot of the work I did during that time, because I felt like it was meaningful, but also it has helped me a lot. It's helped me a lot to be a better nurse and a better caregiver, because I'm not scared to have really deep, really impactful emotional conversations with people. I welcome the opportunity. I don't necessarily seek it out, but I welcome the opportunity because it's very rewarding to help people. That's an internal motivator. That's probably the best thing I like about being a nurse.
So if I'm reading what you've told us correctly, there's a component of strong emotional boundaries and emotional intelligence and critical thinking.
Absolutely. And there's a component of that, but I wouldn't want anyone to think that they have to have that in place when they start a nursing program, or when they graduate, or after they've been a nurse for 10 or 15 years. It's a process where everyone, I know everybody on this panel right now would agree that you didn't know how to be a really, really good nurse when you graduated from nursing school. And maybe you question it even now. I've been a nurse, 27, 28 years now, and I question myself consistently. Am I good enough? Did I do the best I can? Am I as smart as I should be? I'm as paranoid as anyone, but I also feel very solid once it took me many years to learn the skill. I can't say that enough. You learn skills in school, you learn skills after school. And then as you keep learning, you learn that you don't have to be perfect. You don't have to have all the answers. You don't even have to have all the best apps on your phone. You just need to do your best and learn from what you might consider mistakes. That's a gray area. Mistakes. Is it a mistake? Well, maybe you don't do things perfectly, but that doesn't mean you shouldn't have done it, because the next day you might do better. And that's the mantra that I pursue consistently.
I have to agree. I think that nurses continually evolve during their career because we have different opportunities come to us. We meet different types of people, different types of patients. So I do think that that's true. We're always evolving.
Well, thank you both so much. That was so informative. And, you know, I think that the work that you are doing with nursing students creates yet another generation of people that are well-informed, well-skilled, and emotionally intelligent. Would you agree with that?
I agree. I wish I could say everyone is a certain, like everyone that graduates from our program is at a certain level. That is not the case. What we try to do, you know, and not just Boise State, but, you know, I think all nurse educators, we're always trying to get people from wherever they're at to move them along the journey of being a nurse. But you know, I wouldn't say a lot of students are wishing they had more time in school, but everyone's different, and that's a big challenge. You know, we have a very big program, and it's always a challenge to try to meet everyone's learning needs. But it's also, you know, it's something that's important enough to where, you know, I know Paula and we keep doing it.
And doing it well. Dr. Christopherson, you had a really wonderfully diverse educational experience in your journey to becoming a nurse, because you've been to so many different schools. And we're so glad that you're here in the Treasure Valley now. Can you tell us, what advice would you give to today's nursing students?
Yeah, thank you, Ellie. This is a great question. And like Max said, I did spend some time thinking about really what would be the main message I wanted to share with students. And really, it all stems from my own personal vision. And that vision really is, it's very succinct. It's in striving for excellence and not perfection, but in striving for excellence, we tender with compassion the deeds of the day, in the hope that the seeds that we sow will bring promise of an even brighter day. And so when I broke that down and was thinking about the students and a nursing practice, when I thought about in striving for excellence, I thought, you know, it's really critically important for nursing students to understand that they are entering into a really unique learning environment, a really unique profession. And I think it's important for them to know that it's not just academics, but it's really real life. It is about real life. And so, of course, they're going to engage in learning and training, and they're going to engage with faculty and others. But I think it's really important for them to understand that they will be engaging with clients and families who receive care from students. And that really is real life. And I think that's really an important thing for them to think about as they enter into their professional training. So within that environment, I really encourage students to apply the knowledge and the skills that they've gained in their prereqs courses, and really think about how they're going to build on each successive nursing course that they take. And when I think about it, I tell them, you know, you need to really employ your clinical judgment, think critically, really learn how to evaluate the evidence, and really learn to reflect upon your practice, because I think that's very important. And then also use decision-making and problem-solving skills. I think another component that's very important for them is to really display confidence and competence. But I think also to be humble and appreciative, because so many different people are going to be involved in their training and their education. And listening, I think listening is ever so important. Listen to patients, clients, families, listen to the staff nurses, the other providers, other healthcare professionals, and really, obviously, your faculty. Be prepared to ask a lot of questions, to really do a lot of research, to do a lot of studying, and to really continue to think about their learning journey and lifelong learning. And so then that brought me over to how do we tender compassion? And we know that knowledge and skills are really key, but I think that nurses never underestimate the healing power of kind-heartedness and of care. And I think it's really important for them to be able to show authentic kindness and concern, to demonstrate ethical standards, to connect with others, to practice empathy, to demonstrate respect. And I think, and Max alluded to this, but really to create a culture of compassion for your colleagues and for yourself, and to really take time for yourself, to rejuvenate, to be able to give back and to continue to give back. And then when I looked at the seeds of hope, I thought, you know, be ready for different types of questions that you might not have in any other profession. Like, how do you cope with this diagnosis? I don't, you know, the families are sitting here thinking, I don't know how I'm going to cope. Well, what makes my life worth living at this point? So I think it's really important for them to know that they want to reflect upon their role as a nursing student and as a future nurse. And to remember really that they are in a very privileged place and an honored role to be with people during their greatest days and during some of their saddest times. And that they really do have the privilege of shepherding them through those times. And so instill confidence, instill hope, be prepared, be engaged, be on time, and be professional. And most of all, be present, right?
Mm-hmm.
And I think being somebody who finds out what hope really means to not only to the client, but to their family as well, and then work with them to deliver on that. And so back to the question for me, what advice would you give today's nursing students? I would, in a nutshell, would tell them to reflect on what nursing means to them individually, and to then really carry out that personal vision.
Oh, that's amazing. Thank you so much. Now, I know that you advise for what we call the accelerated nursing program. So you are frequently seeing students who are not in their undergraduate degree necessarily many of mine will be health studies, but you may get students from very diverse majors. Do you have any words of wisdom on what you could do as a minor or certification that would enhance a degree that would make students look more deeply into themselves and learn more about how to be nursing advocates, emotionally engaged people, and compassionate bedside critical thinkers?
Yeah, so just looking at the exceedingly qualified candidates that we had for this current cohort, many of them exemplify just the most beautiful traits of excellence and compassion and hope already, coming into the program. But I think many of them were in a health sciences degree or sort of sports physiology, that kind of background that prepared them. Some had education backgrounds, but very, very diverse. Some of them are physicians, and so they just come from all kinds of different educational backgrounds. Many of them also have very different experiences. Some of them have been at home raising children. Some of the potential candidates for our program have been working, as physicians. Some have been working as techs. Some have been working as CNAs in the hospital or in long-term care facilities. So, as diverse as the opportunities are once you're in the profession, those coming to our program in terms of potential candidates are equally diverse. And I think that's what makes it so challenging to select the individuals who will actually start in the program is just because they have such rich backgrounds already in terms of experiences and academic preparation.
Awesome. Thank you all so much. I want to be mindful of your time. Thank you for viewing this. You have been watching What's It Really Like to Be a Nurse with Dr. Tony Christopherson, Max Veltman, Dr. Paula Shaver, and Joanne Adams. And we're so grateful for all of you having been here with us today. Thanks.